Introduction. Today we're going to talk about ascites, a condition you will likely encounter in both small and large animal practice. Ascites, or abdominal effusion, is not a disease by itself. It is a clinical sign that indicates an underlying problem, and your job as a veterinarian is to identify the cause and manage it effectively. Definition of ascites. Ascites refers to the abnormal accumulation of fluid in the peritoneal, abdominal, cavity. This fluid buildup can cause visible abdominal distension, discomfort, and respiratory distress due to pressure on the diaphragm. There are three general types of fluid that may be found: transudate, a clear, low-protein fluid typically associated with low oncotic pressure, often seen in liver or heart disease; exudate, a cloudy, protein-rich fluid usually due to inflammation, infection, or cancer; hemorrhagic, blood-stained fluid, commonly caused by trauma or ruptured tumors. Causes of ascites. Ascites can result from a variety of systemic or local disorders. Heart disease, particularly right-sided heart failure, leads to increased venous pressure and fluid leakage into the abdomen. Liver disease, such as cirrhosis or hepatic failure, causes low albumin production, reducing plasma oncotic pressure and allowing fluid to escape into the peritoneal space. Kidney disease, especially protein-losing nephropathy, also reduces plasma proteins, contributing to ascites. Neoplasia, such as abdominal tumors or carcinomatosis, can increase vascular permeability or block lymphatic drainage. Peritonitis, whether infectious or inflammatory, causes exudative fluid accumulation. Trauma, such as a ruptured spleen or liver, may result in hemorrhagic ascites. Clinical signs. Animals with ascites may present with the following signs: a visibly swollen or distended abdomen, difficulty breathing, especially when lying down, generalized weakness and lethargy, reduced appetite and weight loss, pale or icteric, yellow, mucous membranes, vomiting or diarrhea in some cases. If cardiac-related, you may also notice coughing or exercise intolerance. Diagnosis. Diagnosing ascites involves a combination of clinical evaluation and diagnostic tests. Physical examination, observation and palpation may reveal fluid wave or ballottement. Blood tests assess liver enzymes, kidney function, and albumin levels. Abdominocentesis. This is the most direct method. The fluid collected should be analyzed for its appearance, protein content, and cell count. Imaging, abdominal ultrasound and radiographs help assess organ structure and identify masses or effusion. Echocardiography, essential if heart disease is suspected. Coagulation tests, useful if there is concern about bleeding disorders. Treatment. Treatment of ascites always starts with managing the underlying condition. Depending on the cause, approaches may include heart disease, use of diuretics such as furosemide, and possibly ACE inhibitors; liver disease, nutritional support, albumin supplementation, and medications like lactulose or same; kidney disease, protein-restricted diets and fluid therapy; neoplasia, may require surgery, chemotherapy, or palliative care. Infections, administer appropriate antibiotics or anti-inflammatory medications. Supportive care may also include diuretics to reduce fluid volume, abdominocentesis for temporary relief of severe distension, oxygen therapy if respiratory distress is present, nutritional management tailored to the specific disease. Prevention. While we cannot always prevent ascites, we can reduce the risk by performing regular checkups to monitor organ function, promptly treating any heart, liver, or kidney disorders, feeding low-sodium diets to patients with heart conditions, watching for early warning signs like abdominal swelling or changes in appetite. Summary and key points. Ascites is a sign of disease, not a disease itself. It can arise from cardiac, hepatic, renal, neoplastic, infectious, or traumatic causes. Diagnostic workup includes fluid analysis, blood work, and imaging. Treatment should address the root cause, and supportive care is often necessary. Early detection and regular monitoring of chronic diseases can help reduce the incidence and severity of ascites.